Hey y'all, Ryan here. In today's relevant conversation, we're talking about the coronavirus. We're going to talk about the feelings we're experiencing right now, what we know about the virus, how we can stay healthy, and some of the misinformation going around. Perhaps most importantly, we're going to talk about what this means for unity, for our unity values, and our spiritual development as individuals and a community. Right now, many of us might be experiencing a troubling conflict of emotions. On the one hand, we may have a gnawing anxiety in the pit of our stomachs that won't go away, and on the other hand, we haven't really changed our daily lives all that much yet, or planned for the life changes that we suspect might be right around the corner. I don't know if you felt this way, but I know I certainly have, and it's okay if you feel this way, because right now there's this surreal mix of self-doubt, embarrassment at being afraid, and alienation. And in a strange way, this feeling is almost more stressful than the fear of the virus itself, because we're not sure if we are overreacting or underreacting, and the mixed messages from the government and the media aren't helping. It feels like we're in the middle of a rope in a tug of war between panic and denial, but there is a better way. But first, who should we listen to in this time, right? There's a lot of mixed messages going around, so who should we listen to? On the one hand, the media sometimes freaks out about minor, trivial things, which understandably has hurt their credibility in times like this. On the other hand, the government isn't always trustworthy, and in this case, some of our government officials dismiss the coronavirus as a hoax while secretly selling off their stocks before the economy tanked. So, who should we listen to? As always, in any situation, we should listen to the relevant experts. In this case, medical experts, people who work for the CDC and the World Health Organization. Now, I won't tell you that you have no reason to feel afraid. I recognize fear as a very authentic emotion during this trying time, and I won't downplay it by saying don't panic, because really that doesn't acknowledge how you're feeling or what's happening in the world. So instead, I'm going to share the facts with you, and then give you ways you can turn this pandemic into power for personal growth and spiritual development. Let's start with what we know. How do we know if someone, including ourselves, might have the coronavirus? Well, the symptoms include a dry cough, trouble breathing, sore throat, and a fever. Not sneezing, alright? Now, I understand how we can get this mixed up because it is allergy season and a lot of people are sneezing. A lot of people have puffy red eyes and runny noses. And when you're told that a dangerous sickness is on the loose, it can be all too easy to look around at people who just have allergies and fear that they may have this coronavirus. But that's not the case. And it's important to keep in mind that the best way you can know if someone has this virus is by understanding the symptoms, which again, dry cough, trouble breathing, sore throat, and a fever. Medical professionals have also very recently reported a consistent loss of smell and taste among those infected, particularly those under 40 who have tested positive for the coronavirus. We also know the virus is transmitted through droplets, such as coughing and sneezing. And according to Dr. Michael Osterholm, who is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, reports that the coronavirus can also be transmitted through breathing, hence the importance of social distancing. We also know you can carry the virus without displaying symptoms. Up to about 50% of the cases carry the virus without symptoms, in fact, and you can spread it after 12 days of recovery. We also know that right now the coronavirus is technically everywhere, but everywhere now includes Harris County, Galveston County, Austin, and Texas in general. There's currently a lockdown order in effect, meaning no gatherings of more than 10 people, and there may soon be an order to shelter in place. Keep in mind, just because you keep your gatherings under 10 people does not mean that it's safe. If you cram 8 people into a small room, the disease can still spread easily. This is why, despite how much I really wanted to hang out with my friends yesterday, I had to turn them down. There were only 5 people there, but it was a small apartment and 2 of them work on the front lines as food delivery workers, interacting with potentially infected people every day. I'm not going to claim that it's easy to socially distance. It's not. But right now, this is one of the best things we can do to contain the virus, protect our own health, and protect the health of those we love. This is a very serious virus. Thousands of people have already died, and in Italy, there's so many infected people, the doctors are being forced to make tough decisions on who they treat based on the likelihood of survival. Their hospitals are so overburdened that military trucks carrying corpses have filled some of the streets, and in other parts of the world, governments are being forced to use ice skating rinks because they don't have enough room for the dead bodies. And if that isn't enough to convince you of its seriousness, the US government has pushed back the deadline for taxes. Taxes! Furthermore, young people are not immune, despite what many young people seem to think. People in their early 20s and 40s have fallen seriously ill in parts of Europe, and a quarter of the cases in Italy are between the ages of 19 and 50. There have even been a few young people who have died without having any kinds of complicating issues. So this is serious. So how should we respond? Remember, we don't want to panic, but we also don't want to live in denial. Neither of those states of mind are helpful. For us in Texas, we have to continually remind ourselves that this virus is not like a hurricane. We're used to hurricanes, we know how to prepare for them, but a virus is different. Hurricanes are big, localized, and easy to track in real time. Viruses aren't. Viruses are small, they spread sporadically, and we only know about their location after we've confirmed infected cases, which means it's probably spread since its discovery. It's easy to track a hurricane, hard to track a virus. However, there are some benefits to a virus over a hurricane. In a hurricane, roads are often impassable due to flooding. That's not the case with a virus. Roads will remain open even if a city is on lockdown. Another good thing is viruses don't knock out the power like hurricanes, so there's no need to stockpile batteries, non-perishable goods, or water. In fact, the CDC says your freezer is your best friend, and if you're looking to stock up on food, but not to an extreme amount, to avoid social contact at grocery stores, you can get fresh fruits and vegetables and freeze them for later. A virus is not a hurricane, for better or worse, and there is a better way than panic or denial, although right now we're seeing both of those things. Some people are rushing to the store and stockpiling like it's the end of the world, practically filling up a U-Haul with toilet paper, and other people are outright in denial, going on a tour of bars, restaurants, clubs, and museums thinking they're immune. Neither of those responses help us. Panic in itself is not productive. Fear can cloud our judgment and make us act so stressed that we become paralyzed and unable to act at all. That's not good, especially for your immune system, which takes a dive when you're stressed out. However, denial is far more deadly, especially to the people around you. Denial leads to recklessness and needless danger, like a kid who says they can drive 100 miles per hour through a park without hitting pedestrians because they're that good behind the wheel. Even on a slim chance that they're right, which they're not, why risk it when other lives are at stake? So, what is this middle way? I keep talking about the middle way between panic and denial. What is this middle way? Preparation, prayer, staying informed by relevant experts like medical experts, and adapting to new circumstances as they arise. There's a concept in philosophy I love called amor fati, which is Latin for love of fate. Essentially, it says, if this was fated to happen, which it wasn't, but let's imagine for a moment that it was, if this was fated to happen, how can we use this to our advantage? How can we take a proactive approach to this self-containment? Confined in our homes and practicing safe social distancing, what can we do now that we haven't been doing? Maybe we spend more time praying for each other, taking on the role of prayer chaplain without the official title. Maybe we pick up an old hobby we put down a while back because we didn't have the time, or maybe we call our relatives that we know we should talk to more often, but we just never get around to it because life normally gets in the way. So let's ask ourselves, how can we use this time to become more compassionate, more connected, more authentic, and more inclusive with our unity values? We need to remember, a church is not a building or an institution, not primarily. A church is a group of people who share a common faith and try their best to live it out together. Like Reverend Kira said, we are not socially distancing so much as we are physically distancing. We're not going to deny what's going on. We're asking, how can this serve our highest good? We're asking, what can we do? There's a lot of fear right now. There's financial fear, fear of infection, fear of death, a lot of fear, and fear is a valid emotion. We won't escape from fear by pretending it doesn't exist or shaming ourselves for it. That just pushes the fear down deeper until it simmers and boils, becoming anger and frustration. So first, accept your emotions. They're valid. Then ask, how can we take care of each other and put our community at the forefront of our consciousness? There's a lot of things we can do, y'all. We can call and text each other, share our concerns, and most importantly, share relevant factual information that helps us stay healthy and safe. So how do we stay healthy and safe? You want to wash your hands for at least 20 seconds with an ample amount of soap. I won't go too deep into the science of viruses, but viruses are encased in what's basically fat. Technically, it's called a lipid envelope, but the bottom line is they're encased in a shell of fat that protects them from the outside elements. So what is one thing that soap is really great at breaking down and washing away? Fat, right? Imagine that you've just had a bunch of brisket or you just touched a bunch of butter. If you merely try to rinse your hands off with water, your hands will still feel greasy and oily afterward. But if you use a lot of soap, the fatty layers comes off. Once that fatty layer of the virus is broken down with soap, and it takes about 20 seconds, the physical particles of the virus will be washed away through you rubbing your hands together. This is why experts recommend that you wash your hands like you are handling raw meat with hot pepper flakes and you're going to put in your contact lenses. 2, don't touch your face. The areas the virus can easiest enter your body are your eyes, nose, and mouth. So avoid touching those areas, especially if you haven't washed your hands. You also want to drink plenty of water. Drinking water doesn't wash the disease down into your stomach acid and kill it, as I've heard some people claim, but it does keep you hydrated, which your body needs to stay healthy and fight off infection. Another thing you need is a good amount of quality sleep. Let me say that again. You need a good amount of quality sleep. This means getting to bed and waking up at relatively the same time every day and not looking at your phone or TV 30 to 40 minutes before going to bed. That breaks down chemicals in your brain, which keeps you awake for longer than you should and prevents you from falling into REM sleep, which your body needs to heal. Do not wear masks unless you are sick. It's important to save the supply for the people in most demand, which in this case are healthcare workers on the front lines and those they're caring for, along with those in the food industry. Finally, one of the most important things that we can do is practice safe social distancing. If you have to go out, keep at least 6 feet from other people. And for me, I personally have been imagining that everyone has a horrible, horrible case of morning breath and body odor, and no one has brushed their teeth or showered in a week. And I imagine if that was the case, how far would I want to stand back for them? And that keeps me far enough away. Now, why is social distancing important? It's important because we don't have a vaccine for this virus right now, so we have to engineer our own social vaccine, which basically amounts to A, don't get infected, and B, don't infect others. Avoid crowded places, cancel social engagements, do not travel, and work from home if that's an option for you. And if you need to buy groceries, the CDC recommends you do it at non-peak times of the day, keeping a distance of at least 6 feet. These steps are extremely important in flattening the curve. Now, you've probably heard this term tossed around a lot, but what does it mean? Flattening the curve means minimizing the amount of people infected over a long period of time. If many, many people are infected over a short period of time, hospitals become overburdened and they can't treat everyone. Many people will be turned away, leaving them to infect other people or die. Sadly, we're seeing this in Italy right now, where the hospitals are so overburdened that they're having to make difficult choices between older people and younger people more likely to survive. We also saw this with the Spanish flu in the early 1900s, and, well, that didn't go so well. So what does this mean for us? It means that we have to tap into our Christ consciousness and sacrifice our personal desire for the normalcy we're used to, for the sake of our community, whether that be our neighborhood, our church, our county, our state, our country, or the entire world. This, right now, is a call for compassion and sacrifice, and I'm certain we can rise above the adversity and face this challenge head on. That said, it's hard to face this challenge head-on with consistent misinformation going around, so let's tackle some of the biggest misinformation. Please keep in mind, none of what I'm about to say has a partisan angle to it, it's just the facts. However, some of the people who have been spreading misinformation do have political jobs. I know I said this before, but it's worth repeating. There is this mistaken idea that young people are somehow impervious to the disease. This is simply not true. People in their 20s to their 40s have fallen seriously ill in parts of Europe, and nearly a quarter of the cases in Italy fall between the ages of 19 and 50. There have been some young people who have died without any other health complications at all. So please, if you are a young person or if you know a young person, remind them they are not immune. The World Health Organization of Philippines confirmed the new coronavirus can survive in hot and humid climates as well as cold and dry, so the idea that the coronavirus will die out over the summer is a dangerous myth. The World Health Organization of Philippines also debunked claims that the drinking of water and alcoholic beverages can protect people from the virus. That is simply not true, and in fact, drinking alcohol lowers your immune system overall. There are commentators who say the coronavirus is similar to the swine flu, but it's not. The mortality rate of the coronavirus is 50 times higher than the swine flu, and coronavirus is much, much more infectious. There are also commentators who say the coronavirus is a political maneuver designed to hurt particular politicians' reputation. It is not. Viruses do not go to polling locations, they do not vote along party lines, they don't even know what a government is. There's another guy on a news network who said you can test yourself for the coronavirus by holding your breath for 10 seconds, and if you can do that, then you don't have it. That is absolutely false. The best way to check yourself for the virus is to check your symptoms against the coronavirus symptoms. Coughing, shortness of breath, fever, sore throat, and a potentially sudden loss of taste and smell. And as much as I'd like to say this is the end of the misinformation, sadly we are just getting started. The truth is, despite our government's reassurances, we are not very well prepared for this. In 2018, the president disbanded the National Security Pandemic Response Team and cut the CDC's funding by 80%, despite health experts warning that there was likely going to be a serious flu coming from out of China. Thankfully, though, local governments are handling the response much better. Still, we are desperately undersupplied, and the reason I'm telling you this is not to cause fear, but to help you understand the importance of relying on medical experts and fact-checking claims. For example, the president has claimed General Motors and Ford are making ventilators right now. That is simply not true, and according to those very same companies, no automaker is anywhere close to making medical gear, and it will be months, if not longer, before this is completed. They haven't even started production. On top of that, we still do not have enough testing kits available in places where we need them most. That means we have no idea exactly how many cases there are or how fast it's spreading, only that it's spreading even faster than the current numbers suggest. That said, let's not give in to fear when those testing kits do come in. Why? Because as more testing kits become available, you will see the number of infected people rise. But this doesn't mean more people are infected than before. It just means that we know they're infected, and most importantly, it means we can begin treatment for those people now. Think of it like this. If you have 100 people with a serious sweet tooth, they eat candy all the time, and none of them have gone to the dentist before, and then suddenly they all go together and get reports of cavities, it would seem that they all suddenly just got cavities. But the truth is, they had them before, it's just that now we know about it. We should immediately be wary of those who downplay the severity of the virus. To give you two examples, there are senators who downplayed the seriousness of the virus while they sold off their stock just before the virus came to the US and tanked the economy. 2, for at least a month, Fox News downplayed the severity of the coronavirus, saying it was media hysteria and a political hoax. Not only was this never true, but Fox knew it wasn't true, as they were preparing their own offices for a serious pandemic since February. Lastly, and this is misinformation that could potentially be deadly, the president has said that a chemical called Chloroquine phosphate has shown, quote, very, very encouraging early results in treating the coronavirus, and that the FDA is working to make it widely available. Neither of those statements is true. In fact, an elderly couple who tried this as treatment, well, one of them died and the other is in critical condition. And the FDA Commissioner Steve Hahn said they would need to do a large clinical trial before making any decision on how or even if to treat corona with that chemical. Large clinical trials take time, so even if that chemical proves effective, we won't know it for a long while. Look, y'all, I know this is tough. A lot of people have told me they're stressed, they're depressed, they've got a knot in their stomach, and they're not sure what to do. Well, I'll tell you what we can do. Wash your hands thoroughly with soap and water for at least 20 seconds. Don't touch your face, especially your eyes, nose, mouth, ears, and avoid crowded places. Stay updated on the virus through good sources from relevant experts such as the CDC and the World Health Organization. Practice social distancing and help flatten the curve so our hospitals don't become overburdened. Treat this as an opportunity to come closer to the God of your understanding, to practice unity values of connection, compassion, authenticity, and inclusivity. Include everyone in your prayers, everyone you know, and even everyone that you don't know. Strengthen your sense of spirituality and community. Just because we are physically distanced does not mean we have to be socially distanced. We can pray for each other, our friends, our neighbors, even our enemies, just like Christ would have wanted. We can nurture our Christ consciousness to the best of our abilities. We can reconnect with the loved ones we haven't spoken to in a while. We can pick up old hobbies or try new ones. We can use this shift in the world to shift our consciousness to a more compassionate state of mind. Right now, we are called to care for each other in ways we never have before. That's a challenge, but it's a challenge that I accept. Do you?